I would like very much now to invite Monsieur Alain Pluquet from BioVision, who is going to give us or enrich the conversation further on the industry angle and perspective. So Alain Pluquet is Chief Technology Officer and Corporate Vice President of the Innovation and Systems Unit at BioVision. BioVision is a world leader in the field of in vitro diagnostics. I'm not sure they need to be introduced to this audience in particular, but in case we have any visitors, he has very interesting background, working many years actually with the French Alternative Energies and Atomic Energy Commission, where he held various positions, including managing technological innovation. So you come with a rich background for that. So it would be lovely if you could also give your perspective on where BioVision stands, and then perhaps more generally a little bit diagnostics and digital health.
Okay, diagnostics, so because you have pharma here and you have diagnostic here.
There you go.
This is quite different. So I think there is no need to present BioVision in Lyon. This is a quite known company here. So we are focused on infectious diseases, as you know. We are world leader in this field. And this is a vision of Alain and the Maillot families to be committed to the patients. So compared to the previous speakers, our obsession is to serve the patient, and most of them are really sick, facing difficulties with different bugs, bacteria, viruses. So slightly different from the presentation from done at the beginning, which is more on the consumer side. We are focused on real serious patients. So about BioVision and the Maillot groups and the ICT world, I will start with basically with two remarks and a few examples if I can. So the first remarks is that if you think about diagnostics, diagnostics is an information technology by design, because when you diagnose a patient, what you provide at the end of the day is a piece of information that is supposed to be useful for a medical doctor. So we are an IT company by definition. It sounds bizarre, but that's a reality today. And this is probably why we see many potential interaction and synergies with the ICT world. And you see you have many startups, many companies, many labs developing new solutions. And this is normal because we're working with the same basic element, which is information. Is that a revolution? And that will be the remark number two. Many people have announced big changes in the ICT world and in the healthcare domain. Probably not. I think it's more a long list, a long series of transformations that are ongoing. I don't think it's a revolution because there are some limiting factors today. So the first limiting factor for us is the medical value. In most cases, you have nice companies, nice proposal, but there is no clear added medical value. And our obsession, again, is to bring more value to the patient at the end of the day. The other limiting factor is probably the business model, because it's very difficult to sell that in top of, in addition to what you sell today. And for many customers, this information layer has to be free somewhere. And the business model is a very big question mark in many countries, not only in emerging countries, but also in mature markets. And probably the third limitation is we have to keep in mind that any new solution has to be integrated in existing healthcare systems. So that's very simple to say. That's not very easy to do because you have many constraints, regulatory issues, for instance, or people being very conservative in many countries. So implementing a real solution in a clinical setting is not that easy today, and it will change probably, but today it's quite complex. So to illustrate that, if you want, I have, let's say, 2 or 3 examples, very diverse. The first one is in Africa. So let's move for a minute in Malawi, which is a very poor country. So that's the southeast of Africa, just below what we call the meningitis belt. So it's a small country, very low income, and facing huge difficulties with HIV, tuberculosis, malaria, meningitis, many infections. 60% of the people are dying from infectious disease. That's huge. That's huge. And basically, you have no healthcare systems or very weak healthcare systems. So what we have developed with the Mayo Foundation, because it's a non-for-profit approach in this case, is a super simple app, very basic, to triage a patient when they arrive in the hospital. So especially for young children, because the risk number 1 is to misdiagnose those kids and treat them for malaria when they have meningitis. And it's a very basic app. You have to answer a few questions. Basically, the mother will answer the questions. You look at a few clinical signs, and then the apps will tell you is that green, orange, or red, depending on the risk for the patient. And even for that, such a simple solution, it's very difficult to implement it in real life because you have many people to train, because the professionals are not very professional, because they don't have the experience to implement a rigid protocol, because the medical doctors are not trained, because etc. You have to change the mindset. So implementing very simple solution is not that easy, even in complex, in very in theory, very simple situation like this. So that's the first lesson learned. Example number 2 is completely different. Then we move from Malawi to the US, so a very rich country. In the US, we have a big customer called LabCorp on Quest. So it's a huge organization dealing with clinical samples, so clinical laboratories, so to speak. So typically they process something like 500,000 specimens a day, so big factories if you want. And it's very interesting to see how they define themselves now. They define themselves as a knowledge service provider or medical insights provider, not anymore at clinical diagnostics. Diagnostics is a forbidden word now. They sell services and IT services. And of course, instead of pushing the information to the medical doctor, they push the information up down to the final user, which is the patient, transforming this field into a new area. This is example number 2, where your information technology is transforming the domain step by step. And a third example, as you said a few minutes ago, is let's say the big data thing, which is the fact that you are now able to characterize humans and also microbiomes, bacteria at a very detailed level using sequencing and proteomics and metabolomics and all the omics, which is very good. But again, transforming those nice assets into a real, actuable tools for a patient is a big question mark. We don't have now the possibility today to transform into real products today. So there is a big question mark. Will we be able to transform those data, those nice big data, into real services for our patients? So in a nutshell, ICT is a big opportunity for us. We do see some first very convincing realization, but for the mid-long term, we will still have the same question about what is the medical value, what is the business value, and how can we implement that in real clinical settings. I think that's it for today, unless you have questions.
Thank you so much for giving us your perspective on this. Well, I hope that BioVision will keep then investing in this field, which.
Just a few added new comments. We keep invest in that domain. So we just acquired a new company a few months ago, just before Christmas last year. A very small company called Apply Mathematics, if you want. A very small company based in Belgium, focused on bioinformatics and microbiology, so a combination of biology and informatics, because we think that for the future it will be key for the new product. So we are investing in that field and paving the way for the future. Yeah.